All right, welcome back everyone to another episode of Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi. I'm joined by my co-host, Mandi, Dickey. You probably heard her more than you have me, lately. So it's good to be back here. And today I thought that I would talk to Mandi about breakthroughs in health and wellness that are coming through. You know, we've spent so much time, here on AM 950 radio, just talking about, our kind of hopes and dreams for the future, and always complaining about, how bad the medical system is and how people are having such a hard time. Actually, this week I just wrote two blogs. One was on how horrible the insurance problem has gotten for patients, between how much they're spending. Some families of four are spending up to $50,000 a year on insurance premiums. How do we get here? It's terrible. We're not going to talk about that on the show, because that we need a 6-hour show to go through those things. But also, between deductibles and that, people are really struggling. And actually, some people are seeking not to go and get care. And so I think never before has the integrative health world been more important, because people have to decide whether or not they want to invest in their own, health. And sometimes, spending a little bit of money out of pocket can save you a ton, even in the traditional medical system, because again, just because you're insured doesn't mean you're getting the stuff that you need. So that was one topic. And then on the other side, so that was more like a really deep dive, a lot of science in there, quoted. There's a big bibliography just to kind of prove that point. But on the flip side, then it was just kind of how to be the CEO of your own health, and why it's important to actually, people have this kind of idea where it's like, oh my God, that stuff's not covered under. Why? It should be. Whether or not it should be, there's a lot of things, that should be. I'm sure that you should all drive Mercedes. A lot of things should be, but that doesn't mean that's how it's going to be. So you don't not leave your house because you don't have a Mercedes. You go in what you got. So we've got what we've got, and we have a lot of great tools to help people that are not necessarily inside the health system. So it was just kind of a call for people to just get out of it, because a lot of it's just psychology. But on that note, there is a lot of great stuff going on, and I think it's going to help. What do you think so far about what we're going to talk about today? I mean, are you excited about what's coming down the pipe, or are you just I'm not seeing anything?
Oh no, I'm super excited. I think right now is actually a really interesting time to be in medicine if you're an open-minded person, because there's so much coming up, and there's the last couple of years the research on some of these typical outside the box thoughts have just exploded. Mm-hmm. So there's more and more research backing up the things that you and I are referring to all the time now. So hopefully that means our colleagues will start referring for those same kind of things too. So I think it's an exciting time.
I mean, I think that the American public just really needs to be educated on what's available out there. I think there's great stuff happening in traditional medicine. I think that, and we're going to talk about AI and some of the different things that are happening there. I'm obsessed with AI, by the way. I'm going to do a couple episodes just on AI. That's a whole other thing. But I think that in outside, kind of the box, I think the American public is starting to drive a lot of this, because they have social media, they've got television, they have stuff. And if they go on there, all you have to do is click on one of these biohackers or one of these people that are longevity experts and things like that. And then your feed is just full of this stuff. And then you start looking at it, and then you start questioning, is this real? And then you start looking at it more, and then you're like, well, why am I not doing this? Then you ask your primary care doctor, who has no idea what you're talking about. And then next thing you know, you are starting to seek, options. And I'm sure you're seeing this even in the, in the neurology, world, because people, want different things.
Yeah. People come in all the time with questions, and thankfully I am keeping up on all of these things, because they'll ask me, well, what do you think about this treatment? And I'll say, well, it's good for this, this, and this. And I don't know that it'd be good for you potentially in some cases, but it's more because I've had that educated answer. It's not like, well, I don't believe in it, so no, we're not doing it. So if you stay up on the research, you read the new things, you can give patients educated answers on whether or not it might be beneficial. And a lot of things don't come with side effects. So,
but you hit right on it. A lot of these things have so much lower side effect profiles. We'll pick that up on the other side of the break. Recharging the Human Battery Radio, 9:50 a.m. We'll see you in a minute. back on the other side of the break, Recharging the Human Battery Radio. I'm here with Mandi, Dickey, my co-host. We're going to have a great conversation today about the future of where things are going. I know you guys always want to stay abreast on kind of the latest and how we're thinking. Now, if we wanted to talk about everything that's going on, I mean, it's a 10-part, 20-part series. So what we tried to do is just pick a couple of different topics, a couple different things that have come out there that are really relevant. And what we were just talking about on our little break, as you guys heard the commercial, is, I mean, it is a great time to be alive. There's so much coming down the pipe with AI and robotics and discovery of new molecules, but also discovery of how we can use things like energy medicine and light and water, like structured water therapies and all these different things. And I think that all these new technologies are going to allow us to really rapidly do the science behind it. And that's really what's changing, with the advent of AI, which is the first thing I'm going to kind of dive into. AI, first of all, let me start this way. AI is advancing at a pace that is so rapid. And the problem with the way that people are looking at AI, and I'm talking about my colleagues in medicine, but also the lay public, our brains, we don't know how to think in exponential terms. It doesn't really make sense. It's just like that, the thing people always talk about. If you double a penny, if you start with a penny and you keep doubling it, by the time you get to the 36th double, the 40th double, I mean, it's ridiculous. Try it and see what happens. And so we can't think that way exponentially. We're just stuck. So the speed of progress in AI right now it's immense, and nowhere is it going to give us a better window into treating people than medicine. I mean, it's going to change everything. So far AI is solving the riddle of like protein folding things. I mean, there's some of these questions, people have asked these questions for 20 years. AI solved it in just a short period of time. It's incredible. There's all these new molecules that are being created, but the exciting thing is, and actually Mandi was just saying she just flipped over to the AI Scribe, which I've been using now for quite a while. But the exciting thing is that with AI, generative AI, the way it works is it can take these massive data sets and make sense of it. Good luck to human beings figuring out, like, when you have 1,000 variables, like you can't even figure out like what trends are and things like it takes years to do this and massive staff. Now you just need one AI agent and it's going to figure all this stuff out. I think I mentioned it before on this show about, like, for example, there's this company Palantir, and they're huge and they do a lot with the US government, but they actually have partnered with Cleveland Clinic, and they have a digital twin of the entire hospital. And basically what they do in real time, it's kind of the all-seeing eye. It knows everything that's happening in real time. So it'll give like communications on which patients are at risk to go to the ICU, which patients are at risk to have delayed discharges, who in the emergency room needs to get taken care of like right at this moment, understanding that, because it understands data better than humans do, and it's already saving a ton of money. And this is really the future and where we're going. Pretty soon we're going to have these autonomous agents running everything that we do. And AI is just a big passion for me. It's something I study it a lot, and I'm doing some work with AI with some research scientists now, and it's just fascinating. What do you have you now? I know you just went to to generative AI. Yeah. Do you personally, are you using AI in your life at all? I got to put you on the spot.
Yeah, I'm one of those that's going to be a late comer probably, because I personally, it makes me nervous, to be honest. Yeah. And I worry about some of these things where people's jobs can go away. Now, I like it in areas where it makes things easier and it doesn't harm anybody. So getting onto the AI Scribe this week, I was very nervous going into it. I don't know how it's going to work. And I was pleasantly surprised how well it summarized our conversations, and it included almost everything I wanted to. I had to still put a few details in, but for the most part, you
have to teach them.
For the most part, I was really pleasantly confused, and I had patients coming in, or pleasantly surprised. Yeah. So.
Or both.
I'm sometimes I'm pleasantly confused.
Most of my life existence is pleasantly confused. But go
I have had patients come in, though. I had a couple actually come in this week who, after a brain injury, it's even more difficult to try to understand how things go in life. And they actually used ChatGPT to help them build a plan. So one of them was confused about when she was supposed to be taking her medication. So she plugged it all into the ChatGPT, and it created a plan for her. So when she had to take everything and monitor herself, she couldn't have done that normally with her brain injury because she couldn't concentrate and comprehend everything that was there, and AI helped her. So in those instances, I can see a huge improvement and benefit to patients when they struggle, and that can help them.
Yeah, I think that the benefit to patients is going to be immense, especially with wearable technologies, with other, like as we can track all of like what's going on in their bodies from a molecular standpoint in real time. And then we'll be able to really do so. One of the things you brought up is this patient, right? That was able to use ChatGPT to do some other things. I mean, the thing, folks, is most people that are new to AI, they think ChatGPT is like this, like some people are just amazed. They're blown away when they see how quickly it can think and what it spits out. I will tell you this again, talking about exponential. ChatGPT is it's a baby still, because I know I've started to work in some other like different models that are more specific for medicine and things. It's unbelievable what it's going to be. And so I know you say you're going to be a late adopter and a lot of physicians and, the nurse practitioners, whatever, a lot of them are really concerned. However, I don't think that necessarily these things are going to take all of our jobs. Okay, I don't know what the future is with AGI, right? If something's a billion times smarter than us, we're going to have a kind of a hard time to compete with these things. But I think, at least in the foreseeable future, I think it's a phenomenal tool to use alongside, what we're doing. I just give an example, like for, I recently, like in my integrative health world, I've recently seen a couple of like seriously complex people that had a lot of stuff. I was able to take a lot of their kind of data and things like that and just crunch it in a certain way and come up with a plan that would have been different than even going to the textbooks or even getting on the horn and talking to 10 different specialists across the country that have seen a lot more of these patients. Why? Because all their information is already available.
Yeah.
Everything they've spoken about and written about is available. So we have all these tools available to us, and it translates into better care, for the patients. I think there's just so many things that AI is going to let us know. Like, so for example, this first paper that I was going to bring up, nature is a big deal, right? Getting into nature, like these scientists, like they bend over backwards. But I'll just read the title for you: Generative AI Foundation Models for Accelerating Discovery in Materials and Radiology. So what I'll tell you is this is published in Nature, like I said before, and Nature Machine Intelligence. It's this paper, and it's actually from Microsoft Research, from Microsoft. So you see it, like everything is coming together. The singularity, it's all kind of meeting. Robotics, AI, just like all this different machine learning. But anyway, it improved radiology analysis time by about 40%, was kind of the idea of this, but also for developing materials, it's accelerating at a huge rate. One of the things, I'm part of the Society for Brain Mapping, and you should definitely come give a talk this year. I'm signing her up while we speak here. It's in March next year. I'll talk to you about it after we're done with the show. See how we do? We just kind of do like the course of normal business here while we're talking. It's good. You guys get an insight into the things we talk about. But like one of the let's just get back to where we are. It's really going to give us an opportunity in the spine world as we look at spinal cord injuries, for example. So one of the things in spinal cord injuries is you have to regenerate the neurons and everything around it, right? So the actual, like the biological material, the problem with it, even using stem cell technology, light technologies, all these different things that are all coming together for spinal cord injury, you still have to form these tracks where that stuff regrows. right? It's just like if you're going to reconstruct a nerve and you don't just like kind of splay it all over the place and it just grows. It'll grow, but it'll just grow randomly. You want it in a certain tract, right? So when you reconstruct a nerve, you're putting it like the place where it has to grow one place to another, you put it within a sheath so it stays along that track. Same thing can happen in the spinal cord. These nanomaterials, they're tiny. So you can build these columns that then the nerves can regrow so the tracks can regrow the way they're meant to be. And AI is making like leaps. It's unbelievable what's happening in nanomaterials. It's literally unbelievable. In fact, the founder of the Society for Brain Mapping, which I'm the co-chair for Spine. His name is Dr. Kateb. He actually has a book of nanosurgery, and it's like you read it and you're like, is this even real? Like, what are we reading here? And it's just fascinating because the next edition, this was a most recent edition, it just came out. The next edition in a couple years is going to be they're going to have to rewrite the whole entire book. That's how fast things are moving. We can't even keep up. So, I think I'll just give you another one because this is perfectly relevant. So here's another article that just fascinating. And this one's in the Journal of Medical Internet Research. That one, I have to say, I haven't heard about that one, but it's interesting. AI applications for chronic condition self-management, a scoring review. Think about it. That's just what Mandi said. It reviews 66 studies looking at AI chatbots and apps. It boasted adherence to diabetes and hypertension plans by 25 to 40%. So personalized medicine. So now let's think about, for example, this is what I'm working on. Okay. I don't want to tell everyone all the things I'm working, but one of the things I'm working on is I'm developing alongside of these AI scientists a chatbot that kind of is going to create plans for patients based on just integrative health models and all these things. So you have to plug in just a ridiculous amount of data to get what you want. But what it can do is alongside of like a bridge, which you're using for whatever, now you have this other thing that then will, by the time you're done seeing the patient, and then you can add whatever you want. You can say, hey, let's do research on this area, whatever. It can actually then develop a customized plan for that patient. And you can do it like it can do 100 pages. You can actually customize their plan for 5 years and with everything they're going to do, everything we need to watch out for when they need. It's just fascinating. What you can do. And the face that you're making is the face that I get from most people I talk, because I just talked to a couple of health systems about some of the ideas that that I have for them that could make them more just things run smoother, but also save a lot of money. Where we are right now, it's fascinating what's coming down the pipe. And again, it is progressing at a speed. How nice would it be for you if you saw a patient, you spent an hour with them, and then you have a customized plan based on your ideas. Okay, it's not necessary, and it might make some suggestions. It might have some pop-ups that say, "Hey, have you thought about adding this? And have you thought about adding this?" Or Dr. So-and-so that's at UCLA has had great results with this. So it'll tell you all that stuff. You just have to let it know like how you want it to interact with you. Imagine that, and then all you do is then you review it with the patient. You press a button and you hand them a piece of paper, and you have an entire strategy in place. Do you know how long that would take? I mean, we could spend days thinking about how to treat one patient. You have it in real time. Just hand it to them.
Right.
So these are like things that I'm working on. It's going to take a while because you have to teach these things and do stuff. But would you want a program, like that?
That could be helpful. So a lot of clinics don't have case managers, and that's what a case manager would do. Would be to help that patient come up with some sort of plan and keep them on track with things. We don't have that in my neurology clinic. Many clinics don't have that anymore. They're becoming fewer and far between. So having that assistant where we don't have it right now, that would be huge.
And it's the economics too, because I talk to health systems all the time. I sit down with them and I say, well, how can I help you be more efficient? How can we do this stuff? It's the economics. So when you're doing like return on investment, okay, we'll do a little inside baseball, folks. Okay. But when you're doing return on investment, it's hard in healthcare where, health systems are barely floating. Private practices are barely floating. All these people are barely floating. It's hard to show sometimes the return on investment for the patients is good. right? Having a case manager, but from a hospital system standpoint, it may not be good, or you may not be looking at the right metrics. Another place where AI can help, because people just don't understand. They're just like, this employee costs X amount of dollars. They're formulating plans for 10 people a week. Our AI agent can formulate plans for 1 million people a week, 10 million. It doesn't matter. You plug it in, it comes out. And so I think it's going to save a tremendous amount of money. But, you know, if your head is spinning so far, be prepared for it to spin more over the next couple of years. You ain't seen, like, if for those people that are in my circles that are really interested in AI and do a lot of reading, they're part bewildered because it's amazing, like, what's going to happen. And they're part a little bit very nervous, because the truth is, if you ask the best people in AI, what is 2030 like? No clue. They have no clue. They're like, yeah, we kind of know what 2027 is going to be, as far as affecting the job market, as far as affecting the way people work, as far as affecting if we need universal basic income for people, because people aren't going to have anything to do. But then you take it to 2030, clueless. They're like, I don't know. I have no idea. They're like, it's too complex. We can't think like that. You know, I think even AI is confused on what AI is going to be in 2030. We could do that experiment kind of towards the end here. All right, let's shift things. We can have an entire segment on AI. AI just really deserves its own thing. I have a couple podcasts coming up too on AI, so check those out. But anyway, weight loss drugs and metabolic marvels. You know, we can go. We've talked about on this. I'll have to admit, when these drugs first came out, and they were all over the news and television, I'm always wary of things that are going to cure the entire planet, right? And that's what, and we were hearing a lot of that things from the executives of the companies, Eli Lilly, Novo Nordisk, all these big giants. I'm always skeptical as a physician to start getting sucked in, because we've all been there before, where we get sucked into some fad. And, you know, and it looks like it's great. The studies all come out. It's all amazing. And then it's not so amazing, right? We've been down this road many, many times. But I will tell you that the more that the data comes out and the more we're seeing, you know, there's pros and cons of them. But for those people that can be compliant on the weight loss meds, their cardiometabolic parameters it's really impressive how much better they look lab wise. Okay, how it's going to overall translate, yeah, there's some early stuff coming out that maybe their risk of heart attack and stroke and things are coming down just from these. And it's not just the GLP-1s. Now we're like getting into just all kinds of derivatives of them, and they have different actions and things like that. But over time, I have come around. And so now when you know, again, none of this is medical advice. When people come in now and they're like really morbidly obese, and they have their, like, for example, their glucose parameters are off the charts, and the, you know, A1C, all this stuff, I'm actually very much in the camp of thinking about it, because, as you know, it's very difficult to put people on very strict dietary exercise plans and stuff like that. That is definitely part of the plan. I talk about this ad nauseum. But the truth is, if we have something that has a safety profile that's safe enough that at least we can help people, no, I'm not going to put people on GLP-1s if they're, you know, 10 pounds overweight. And they ask all the time. And I'm like, no, but there's a lot of other things we can do. And it's just not that. It's just that it's a drug, and you know, it can have side effects. What do you what's your thought on the GLP? And I want to talk about there's a couple other issues on GLP-1s, but I want to talk about some of the oral drugs that are coming out that are going to actually be approved very shortly by the FDA. Because, as you know, once you have a pill, now we got an easy pill. You don't even have to inject yourself anymore. You just pop a pill. So yeah. What do you like? What's your general take on it? Either way, have you come around, or, you know, what do you think?
I'm still kind of in that iffy camp. There's, I see benefit. It improves people's cognition over time, because we know that diabetes can lead to dementia. Yes. So if we're improving those diabetic numbers, yes, it reduces their risk for dementia later on. So there are definite benefits to it. And for patients that just don't have the ability to be really super strict with their diet and exercise, when you get to a certain weight, it makes it difficult to exercise. And if you're, depending on where you are economic wise, you might not be able to afford all those healthy foods. So for some people, it's not an option to do all these super healthy foods and try to exercise. So it's a good option for patients in that regard. But I'm still kind of iffy because we don't know the long-term effects of it.
And it's true. We really, we don't know. I think that the reason that I've really come around to at least being open about it is just because, again, some of the parameters that we're seeing are so dramatic. Now, is it true that there's a big subset of patients that end up quitting it? Some people call these things the vomit drug. I mean, it's literally like it's a name. It's out there. So feeling like you're going to throw up all day, having nausea is one of the most. It's one of the most things that we like to avoid as human beings. Like, there's something about nausea that's not good. And the reason it's such a powerful thing is because that means that you got to get something out, like something not good that can cause even more damage. And so we're faking it. We're doing it on purpose. It's not like something has to come out, but you feel like it. And it doesn't feel great to some people. Some people tolerate it fine. Like, they literally don't feel anything, and they really do have appetite suppression. So I think that the attrition rate is going to be harder. I think it is going to be helped with the oral medications. But let's talk about this new medicine that's going to come out. It's really a landmark study by Novo Nordisk. Now, this one's in the New England Journal of Medicine, another really well-known journal. But this oral semaglutide, okay, it didn't show as dramatic a weight loss as the injectables, but it still showed over 68 weeks 15% decrease in body weight. Okay, and that matched Wegovy. Okay, but it also slashed cardiovascular risks, okay, like heart attack, by 20%. That's actually a big deal. Now, I have a lot of mixed feelings, like you do, for other reasons. One is that it does bother me in a way, but again, it doesn't matter what bothers me. It's what's best for the patient. So whether it bothers me or not, I'm going to do what's best for the patient, knowing what I know. It bothers me that we've become a country where anything that's hard, we don't want to do. And that's not for, we have a lot of people that are very motivated. I'm not picking on anyone. Relax. It's okay. But there are a lot of people that they don't want to do anything. So when I talked about the becoming the CEO of your own with this recent, blog that I wrote, it's not just about investing money, but it's also about investing time. And some people, I don't have time for that. I don't have time to go to the gym. I don't have time to buy my own food. I'm just going to order, McDonald's or Wendy's on DoorDash 3 times a day. Not a good idea, by the way. I think that. So anyway, I don't want to empower people to not do anything anymore, right? There's a movie called WALL-E. If you haven't seen it, please go see it, because we're going in that direction very rapidly. That's a whole other thing. We could do an entire. Honestly, there's so much psychological cool stuff in WALL-E. We could do an entire episode. In fact, we should. That's a good episode. Just breaking down this movie WALL-E. If you haven't seen it, please go see it. The other issue with these medication, again, oral's coming. I think it's great. I think it's going to be easy for some patients. A lot of patients don't want to inject. But the other thing is that the monetary, paying out of pocket. So I was really pleased yesterday when the announcement was made, by the White House and the powers that be. This isn't a political show. It's okay if they're doing good things, but they're reducing copays in Medicare, to $50 potentially a month. That's amazing. Now, how it's all going to work, I don't know. I haven't looked into kind of the gears the way it works. I don't know if I can prescribe Medicare patients that today and they're on $50. I don't know. I have to look. Again, the devil is in the details. But I think it's great that even our government is looking to lower it, because they understand. That doesn't mean that everyone, I just heard Dr. Oz, talking this morning. It doesn't mean that everyone, he's like, obesity is not a deficiency of GLP-1 medications, but if we have a medication that can reduce it, it's going to reduce our healthcare costs. So I think that's really worth it. So again, we've covered the obesity drugs to some degree. We can do an entire episode. If you guys are interested, let us know in the comments. Now, peptides is something, I've talked about before. So the thing that the other positive, I think, about these obesity drugs is that they're peptides for the most part, right? Semaglutide is a peptide, so it is putting other peptides on the radar. To be honest with you, as a physician, again, this is another thing that wasn't necessarily on my radar at all. We don't learn, I'm sure you didn't learn one thing about peptides in nurse practitioner school. I didn't learn anything about it in doctor school, but yet here we are. And so the peptide you might know the most, insulin, for those of you that are listening, it's been around for a long time. And how many, millions of lives has insulin saved? But there are these small molecules that are between 2 and 50 amino acids. They penetrate the blood-brain barrier. They get to where they need to get like instantly. They're a lot faster than traditional like drug delivery mechanisms. And they're really shifting right now from like these little niche corners to the mainstream. And people are asking about them. Okay. So what I will caution is that people can go online and there's all these research peptides and stuff like that. The problem with those pharmacies is they're not regulated by the FDA. So as a physician or you as a nurse practitioner, that's no touch for us. If a patient asks me, I'd just be neutral. I'm like, well, I wouldn't recommend it, but you do what you have to do. I can't, people are going to do what they're going to do. I can just give them my advice and guidance. But there are a lot of peptides that you can not, like there are the ones that the classic ones, the weight loss ones, but there's peptides for, for brain fog. There's peptides for autoimmune dysfunction. There's peptides for regeneration. And I'm not going to get into all those right now, but they can really make significant impacts. We prescribe them off label, but as physicians, nurse practitioners, we can do that as long as we, explain the risks and benefits and tell people that it's off label. But again, I want to be cautious. If you're interested in peptides, either come in and see an expert to discuss it, or don't do it, because you shouldn't be sourcing from places that are, but please go on social, go online, look at people. You're going to find a ton of medical professionals talking about peptides if you go on social media, and they're like really excited about it, because what we've seen, and I've seen a lot of good stuff. Again, this isn't a medical advice show, so I don't want to get like really in the weeds. I can do a specific episode on peptides. But for example, there is one peptide, that I'll talk. There's something called like MOTS-c. Again, I'm not recommending it, but it's a mitochondrial peptide. And you can boost your mitochondrial, function, and it really can improve people with so many aspects of their health. There's something called 5-amino-1-MQ. There's all these other drugs that can actually also help in weight loss with less side effects than all the weight loss medications. There's things called exercise mimetic peptides, which basically when you take it, your body thinks you're exercising. So you get all the benefits of exercise and you're not exercising. Now, here's the kicker. If you combine those with actual exercise, you're going to get the much more benefit. So it's really amazing what we can do. And I can tell you, I treat a lot of patients for weight loss, and using these kind of things that don't make them feel like vomiting all day has really been a boon. Now, those are going to lose weight faster if you take those, but it makes sense. Think about it, folks. If you feel nauseous all day, you're going to lose weight. Just going to let you know, you're going to lose. There's other things we can give you to make you feel nauseous. You're also going to lose weight on them, but let's not get into that. It's unpleasant. When did you first hear about really? Does it ever pop up on your social media or anything like that?
Not really, no. I did for a while though, worked with a chiropractor, and we did stem cell therapy. So we started getting into the peptides a little bit there. So I had used it for some hair regrowth. What's what we used it for in that clinic. So
awesome. Yeah. So you beat. What year was that?
That was 2022.
Oh, you way beat me to the, if you would have said to me, name 5 peptides, I would have just said insulin. Don't know any others.
Oh gosh, they all have abbreviations that I can't remember though. So there's they're not names.
There's so many peptides, and what's actually interesting is that some of the there's a class of peptides called nootropics. It's interesting. They actually can make you smarter. This is real. Like this, I'm not saying this. And again, you have to talk to medical professionals, but I mean, you give these things to rats and they can do the maze a lot faster. This is real stuff, right? This is like stuff that's in movies, and they're safe. A lot of them have been invented actually by these Russian scientists. It's actually fascinating. It's fascinating. You know, Russia, like, they really like to get their people performing at the highest levels, right? So if you tell me that there's things to take to whatever, so from my aspect, yes, you guys are all thinking, yeah, I want to be smarter, you know, I'm going to beat my brother in chess, whatever you guys are thinking. But think about it a different way. If you have a traumatic brain injury, if you have early Alzheimer's disease, what about using peptides that are known to regenerate, you know, like neurons and synaptic, you know, reconnect the synapses? Why would we not do that in conjunction with like the light therapies we're doing, utilizing different types of dietary changes in things like Alzheimer's disease, which clearly show it. And I'm seeing more and more clinics now, and it's great, you know, doing some of the stuff we're doing, combining all these things, and they're getting amazing results. And I just saw one yesterday, a clinic, I'd never heard of it. It's like someplace in San Diego, but yeah, they have all these people, and we're seeing the same thing where they're doing the light therapies, they're doing peptides, they're doing the dietary management. And some of the people, they're like, this is the first time that they've recognized a family member in 2 years, in 3 years. This stuff is out there, but we're not talking. And you're in the neurology field, so you know how much it's not being talked about. So like that combination, like peptides, dietary management, you know, and light therapy. How many neurologists have you heard echo those three? Like it's not even on the radar.
I think the people on the radio can see the big fat zero that I'm holding up.
It's a big fat. Yeah. She's got a big fat zero going. There. Or if you're watching this on, you know, on this, there you go. We got the big fat zero going on. All right. So peptides, phenomenal advances. I mean, I could pull up study after study. Something I'm really passionate about, you know, we've talked on this show about regenerative medicine. Regenerative medicine is absolutely, you know, the future. It is unbelievable. Here's just one article I have. This is in the Lancet Rheumatology. People that have rheumatological disorders really have problems with their joints. They end up getting hip replacements and knee replacements and shoulder replacements and just pain. But anyway, there's this big group out of Europe. It's this big consortium, okay, and they call it a bombshell. You guys can decide if it's a bombshell. This is in Lancet Rheumatology, June, 2025. But it was a randomized trial. They actually showed that utilizing adipose-derived mesenchymal stem cells. I'm going to clarify that to you. We take stem cells from your fat tissue. Very easy to do. It reduced pain in the knees. Okay, I believe, yep, it was only for knees, 65%, and it regenerated cartilage thickness by 1.2 millimeters at 24 months versus placebo. Okay, here's where the bombshell part of it is, and this is one that it's really, really interesting. This is level 1 evidence. When we talk about levels, right, they go from 1 to 6. Level 1 evidence means this is real, randomized trials that are blinded. These are great. It showed, it was the first time that stem cells are shown clearly that they can reverse, not just slow osteoarthritis. Okay, I'm sorry for you joint replacement guys, but the good news is, as orthopedic surgeons, you could all start doing these injections and really help your patients. So this is the cool thing. They looked at the cost. The average cost for that procedure, for a one-time procedure, $8,000. Total knee replacement, $50,000 plus. Guess what? And this is really exciting to me. FDA fast track review is underway. This needs to be approved yesterday, right? I'd rather have this all day than a total knee replacement. I know I'm an orthopedic surgeon. Please, for any ortho guys listening to this, please, okay. Don't stalk me. Don't throw things at me. Get involved in regenerative medicine. That's the best, way to do it. They also, as an aside, in that thing, found that early intervention, but also controlling people's weight. Because I want to give one other, statistic. For every 1 pound of weight that we lose, it's 4 pounds less pressure on our knees. That's all you need to know. I mean, that's it. All right. Other things, in regenerative medicine, there is like regenerative medicine to, rebuild skin cells, like even after people have like burns. Okay. You guys are thinking, but what about, I just want to look better. In cosmetics, regenerative medicine is huge. What can be done, the old vampire facials and using PRP and all this different stem cell stuff. but also, you know, there's regenerative medicine for sexual health. There's going to be there's total body regenerative medicine. We've talked about it a little bit on this show, which is giving total body stem cell treatments for longevity, for autoimmune disorders, for all these other things. And again, those are not FDA approved yet, but it is coming, and it is coming at a lightning speed. So stay tuned for that. We'll talk a lot more. Our time is done on this segment. It's Recharging the Human Battery Radio. We're on AM 950. I'm Dr. Sinicropi with Mandi Dickey. We'll wrap this all up on the other side of the break. Welcome back. This is the last segment. We're always fired up. We're fired up on the break. You have no idea how fired up we get on the break. Stuff starts flying, and it's very exciting. It's very exciting in the studio. Anyway, we're on AM 950 radio. This is Recharging the Human Battery. I'm with Mandi Dickey today. We're having a great conversation. I'm so fired up. It's a great time to be alive. I tell my kids all the time. It's crazy. AI, robotics, everything that's happening. But as providers, it's good. So what we're going to do is we're either going to become dinosaurs, which many providers are going to become complete dinosaurs, because the stuff we're talking about today, they have zero clue, nothing, not even the beginning. Okay. And I ask you, when you see your providers, ask them about some of these things. If they don't know, at least get other opinions about, you know, what's possible out there. But yeah, it's a great time to be alive. And I think it's a great time to be alive for human beings. I didn't even talk about like longevity research. I mean, the truth is, for those people that can preserve kind of their bodily functions and their brain functions, there are many longevity experts. I'm not saying this is definitely not medical advice. I'm just telling you, with a lot of the people that I respect and follow, if people can basically be of relatively sound mind and body, within 5 or 10 years, the science will start being able to extend people's lives by 50, 70, 100 years. That's how rapid the advancements are going to be. So, why? Because AI is starting to really figure out why we age. Like really why we age, not theories about it. And the thing about why we age is it's not one thing. It's it's not just your telomere length. It's a lot of different, it's inflammation in the body and the way things, it's your genetics, it's all kinds of other stuff. So there is so much coming. It is so exciting. Not everybody wants to, you know, to live forever. And we didn't even talk about augmentation, when we become part robot and part human. I tell you, when I talk about this stuff with my wife, she gets mad at me. She's like, you love all this stuff. You love all this dystopian stuff. I'm like, well, because it's fascinating. And just sitting around, just doing, you know, like the old person thing, going, this is ridiculous. Remember back in the day? That's great. I get it. I love the 80s too. I love the 80s dress. I love the 80s hair, all that stuff. That's great. But it doesn't matter. The 80s passed, and then there were the 90s, and then the 2000s, and then we progressed, and then MTV wasn't relevant anymore. You know what I mean? It just got. How excited are you for the stuff that's coming down the road? I know you're a little skeptical, but are you excited? What about your family? Tell me about what's your family?
Oh my gosh, my husband is big into AI. He uses it all the time, and he harasses me all the time because I don't use it as much. I am a little nervous for the kids because I worry that they're not going to learn how to write papers because they use ChatGPT to tell them how to do it. So I'm concerned about some of those things, but in general, I'm excited because I think there's a lot of new things coming, and we're shifting and we're changing gears, and perceptions are changing, and there's a whole world yet to be opened that we just haven't figured out what it's going to look like. None of us can predict it, not even AI.
No, we have because because it's too much. Again, it's exponential. I mean, AI can predict it better than we can because we can't think this way. We didn't even talk about like brain machine interfaces that are now allowing people to feed themselves that can't move their body. It's insane. And it's not just Neuralink, it's other companies. I actually had a guy that is doing a brain machine interface. He was on my podcast. It was really very interesting, you know, what they're doing. We didn't talk about like getting people's sight back, you know, giving them artificial limbs that they can feel again, but they're robotic, but they feel like normal. Like they actually feel like they put their hand on the table. They're going to be able to feel because we're going to be able to fix those neural networks. So there is just so much coming down the pipe. I think that it is I am definitely an optimist in general, but I'm really optimistic about this stuff. Are there going to be times of dystopia? Yes, displacing so many people out of their jobs and things like that. It's going to be a big problem. Again, I'm not an economist. In fact, if for those that have spent 15 minutes studying, economics, that's probably 13 minutes too long. That's actually a saying, because again, you can't predict a lot of the things that are happening. So we don't know how it's all, going to happen. But this has been great. We haven't talked about AI, wearables, gene therapy. Oh my God, hours on the diseases. We absolutely have to do another episode. This has been great. Anyway, folks, it's been great being with Mandi again on this show. This is Recharging the Human Battery Radio. We are an AM 950. If you get a chance, go learn everything you can about AI. Make sure that your kids know everything about AI, or they're going to fall behind. We'll see you guys on the next episode. Have a wonderful day.